The other thing I want to really mention, which, I get asked all the time, we see all of these kind of acronyms, right? And the different cannabinoids is what they're called. THC, the main one that we know. That's Cheech and Chong that we've known in the past. It's the compound responsible for getting you high, but that is not all it does. It's been shown to be a really effective treatment for all different types of chronic pain, nerve pain, which we have, few things that work well for that. Spasticity and tremors. Parkinson's patients get a lot of relief from this, as do patients with multiple sclerosis. It's proven to improve anxiety and depression, relieve insomnia, reduce agitation associated with dementia, increase appetite, which is a great benefit for a lot of seniors. And it also is super effective against chemo-induced nausea and vomiting, and many other conditions. So that's going to be the probably the most common cannabinoid that you're going to see, and the one that, in culturally we're most familiar with. But I'm guessing you've probably also heard of CBD, cannabidiol. There's sort of a craze around it right now, but for good reason. We have a lot of research on this. It's a totally non-intoxicating compound, so it does not get you high. And one great benefit for using it in older adults is that it has a moderating effect on the high of THC. So it reduces side effects like anxiety, sleepiness, dizziness, and it also increases the duration of action of THC. So it can help increase the amount of time that you're getting pain relief using THC if you combine it with CBD. So you'll see when you go into a dispensary that CBD there is often dosed in a ratio of CBD to THC. So you'll see a 1-to-1, a 4-to-1, a 20-to-1. That's what that means. It's a combination of typically CBD and THC. But on its own, CBD is a really powerful anti-inflammatory. If you have osteoarthritis or rheumatoid arthritis, it's a great thing to add to your regimen. It is really helpful for anxiety, and it's a powerful anti-seizure medication. So, those are just some basics on these two cannabinoids, and you'll see others when you go out there. But when you're a newbie approaching this, you want to be incorporating both of these compounds into your regimen to get the best results.